Thank you, Chase, and thanks everyone who is joining us today. This is a presentation that has been kind of updated over time, but really came out of Banner Sun Health Research Institute. One of our neurologists and I were having a conversation a number of years ago, really about the focus that Parkinson's disease is really about movement. But really many folks experience a lot of emotional changes, behavioral changes as a result of the disease. And so she really encouraged me to develop talking points around really how Parkinson's disease can affect people both physically and emotionally. So I think it's pretty well recognized, as we're calling this a movement disorder, that's the category of the disease, that Parkinson's disease really affects somebody's day-to-day movement. People with Parkinson's disease, and if you know one person with Parkinson's disease, you know that each person is very individualized in the symptoms that they experience, but common symptoms include things like tremors, feeling stiff or frozen. We notice that the way people walk or their gait changes. They can also have dyskinesia, dystonia, weakness, and other symptoms that really affect their mobility and movement. And I think our neurologists, especially ones who specialize in movement disorders, really have become quite skilled in managing these symptoms through medication, and then as well as exercise. In fact, at Banner Sun Health Research Institute, a number of years ago, our director actually did a study on medication intervention as well as exercise intervention, and found that, of course, while medication intervention is incredibly important for people managing symptoms and being able to function day to day, exercise is equally important, and as a result, our neuro wellness program was born. And our neuro wellness program really focuses on helping people with exercises that are specific to helping people manage their symptoms of Parkinson's disease. And there are lots of neuro wellness and exercise programs across the Valley and across the United States. Many of them have moved, as you may well know, during this time to a virtual platform. In fact, our own neuro wellness program, led by Melinda Peterson, we're hoping to launch that next month through Zoom. So this kind of gives you an idea of some of the physical changes that someone might experience as Parkinson's progresses. And we know that Parkinson's disease is a very long disease. People could have it for decades. And so what's interesting is that when you're living with a chronic condition, there are also a lot of emotional changes that people experience. And so in looking at some of the emotional impacts of the disease, I mean, I'm a clinical social worker by background, as Chase was mentioning. I've spent most of my career having the pleasure of working with people who are living with neurodegenerative diseases like Parkinson's disease or Alzheimer's disease or Lewy body dementia. And there's often an emotional change or an emotional toll as people are affected both physiologically and psychologically. And so things like depression, anxiety, apathy, hallucinations, which are really probably more of a behavioral change, are also very common in movement disorders like Parkinson's disease, as well as this is a disease that affects your movement, your emotions, and your ability to get good rest. And so we're going to talk a little bit about those things today. So when we think about Parkinson's disease and emotion, we know that problems with sleep, with mood, and with thought are very common with this disease. And so having the pleasure of work with many people who are living with the disease themselves, as well as many family caregivers, care partners, spouses, daughters, sons, etc. People with Parkinson's disease often say that a big challenge for them is falling or staying asleep. And why is that? It can be connected to some of the emotional changes that we're going to be talking about today, like anxiety around the disease. But it also can be a result of these physiological changes as people have more difficulty moving their limbs freely. Just the ability to get comfortable in bed can really affect somebody's ability to get good sleep. I mean, if you think about your own sleep pattern, maybe you're someone who can't sleep very well unless you're sleeping on your back or your side or whatever position it is that makes you feel comfortable. And then if you have Parkinson's, it's affecting your ability to even get in the most comfortable spot. And so you think about how you're living day to day, and all of us experience challenges with sleep from time to time. Think about how well does your day go when you don't get a good night's sleep? How does that affect your movement or exercise? How does that affect just how you're feeling about the day? Probably it impacts it negatively. So getting a good night's sleep, while it sounds simple, can be very difficult and really impact somebody's wellness in how they're managing their Parkinson's or other movement disorders. So I think we're kind of trying to go beyond just the movement part and really kind of take a look at what someone might experience. We have a large support group called Coffee Talk at Banner Sun Health Research Institute that's been moved and partnered with the PMD Alliance to offer it virtually during these unusual times. But in person, we have, when we are able to have the group in person, we have 50 or more people who are living with the disease and care partners who show up pretty much every Friday. And many of them have shared their story about getting a diagnosis. And many of them have experienced that, they were actually relieved to get a diagnosis of Parkinson's disease. And I don't mean to say that lightly, but what many of them experienced was that their primary care doctor or neurologist, who was maybe a more generalized neurologist, didn't really have a good understanding of their disease, and they might have seen 2 or 3 or 4, up to 7 providers before they got a clear diagnosis. So think about how that affects you physically, but also think about how that affects you emotionally, right? I mean, the unknown can create a great deal of anxiety and stress. And then certainly getting the actual diagnosis can create lots of emotions and challenges as someone is trying to kind of wrap their brain around the fact that their body is defying them and not cooperating. I had the pleasure a number of years ago when I was working in my own private practice in counseling of working with a couple. Both had Parkinson's disease, and the wife used to joke, no, we did not meet at a Parkinson's disease support group. Ironically, we both developed the disease, her husband first and then her later. And she talked a lot about how she experienced Parkinson's disease. She'd been a marathon runner. And so, her body had always been in peak condition. And now, emotionally, getting this diagnosis and focusing on the fact that she might not run a marathon or she might not walk the same way was really very overwhelming to her. And so, really talking about how these diseases affect people emotionally is really an important part of the equation. Because we really want to take a look at people holistically. And so, at our institute, we really try to use both a neurologist who's a specialist in movement disorders. We have an exercise physiologist. As I mentioned, we have clinical social workers, we have neuropsychologists, and we really try to help people look at their disease from different angles to really promote and optimize their wellness. So one thing that we notice is that the person with Parkinson's disease who was maybe running a marathon or maybe taking a walk every day or maybe in full command of their family and their job becomes less certain with this disease. And so the person living with the disease often may become or appear to be more dependent, more fearful, more indecisive, or more passive. As a result of the disease, may feel less confident, maybe even talking less often or withdrawing from family and friends. There are people from our support groups who have talked about one gentleman who shared his story and is actually really a leader in the Parkinson's disease movement now as an advocate and a volunteer in his own wellness. Shared during one of our groups that for a year he really kind of dissolved into a year of depression and really withdrew from family and friends. The people around the person with Parkinson's disease, whether it's the neurologist, the spouse, partner, friends, family, are saying, hey, did you look at the research that you really have to stay active? You really have to get involved in exercise. You really have to stay socially connected. When Parkinson's disease sometimes feels like a veil that depletes motivation. So people may become very isolated, friends maybe become more distant as they either don't know what's going on because some people feel there's a strong sense of stigma and don't want to share what's happening, or maybe they have shared and their friends aren't, these are the kinds of situations where you kind of figure out who your friends really are, and maybe their friends aren't comfortable or are more distant. Social activities or the same kinds of recreational activities may be more difficult. And so taking a look at the whole person and their well-being is really important from my standpoint, my lens. So we know that depression is really common in human beings. We know that, depending on what statistic you look at the average adult, can be 20 or 25% of human beings, adults, experience depression. But we know in living with these chronic progressive neurodegenerative diseases, to say it simply, these brain diseases, depression is very common. Up to 60% of people with a movement disorder may experience depression at some point during the course of their illness. Sometimes it's related to those brain changes, right? And sometimes it's more related to reaction to a diagnosis, right? So, you think about your own life experience and challenges that you faced, whether you had a diagnosis of cancer or whether you were going through a separation or a divorce in a relationship. Depression, if our normal coping skills aren't working, we can easily head down the path to depression. What we know with depression in movement disorders is that they're often accompanied by these other symptoms, apathy or indifference, which affects that motivation we were talking about earlier, and that, feeling depleted of energy, as well as fatigue, which is, you saw from the previous slide, fatigue is a huge problem for people with Parkinson's disease. And we're, the care team around them is saying, hey, get your butt off the couch and move around and get some exercise and stay active and do all these things. And the person with the disease is looking at me like, you try. I've got, this really heavy layer of fatigue that, encompasses me. And while I know what I'm supposed to be doing, it makes it really difficult for me to follow through. And so the good thing about depression is that there are a lot of effective treatments. Medication can be used very effectively, and our medications for depression have gotten more sophisticated over time. And that's really positive in that they have a lot less side effects and can be used very effectively to manage both depression and anxiety, which we're also going to talk about. And then psychotherapy, counseling of some kind, can be really effective as well. I mean, think about the overwhelm that someone might feel as they weren't expecting that this was going to be the way that they carried out their years. And so we're thinking about most folks who are developing this disease over 60. So maybe they're thinking about retirement or what their retirement will look like. And then this throws certainly a big wrench in the game. And then there are a smaller portion of individuals who develop Parkinson's disease as an early onset or at a younger age, as we've seen with actor Michael J. Fox, who's a great example of somebody who's in his books has actually talked about his own struggles with depression and even abuse of alcohol, but really has figured out a way to really effectively cope with Parkinson's disease and really lead by example. So we know that statistically 80 or 90% of people who experience depression can really have very effective outcomes with medication or psychotherapy, but actually the studies show that a combination of both a non-pharmacological approach like psychotherapy and a pharmacological approach to medication like antidepressants really lead to the best outcomes. We know that Parkinson's disease, a brain disease, and other movement disorders, as well as depression, because these are brain issues, can certainly affect someone's memory and thinking. Many people with Parkinson's disease experience what they describe as like a thought slowing, like the wheels are not turning as quickly. And so when you throw depression on top of Parkinson's disease or another movement disorder, that certainly can really magnify someone's ability to think clearly. And then, you know, if you look at the research, so people who do live long enough with Parkinson's disease, as many as 50%, I'll say, or more, if you asked my colleague, Dr. David Sprecher, the director of our Movement Disorders Center at Banner-Sun Health, he would say more. As many as 50% or more may very well develop a dementia as a result of their Parkinson's disease if they live long enough. So depression can be related, as we said, to kind of the blow of having a progressive disease. It also is related to a change or loss in someone's abilities. You know, this dyad that I was telling you about earlier, the husband and wife team who were both living with Parkinson's disease, you know, she was sharing the losses that she's experienced, you know, taking a lot of self-esteem from the fact that she had been so physically fit and done a lot of running and achieved and completed lots of marathons. And, you know, as her disease was progressing, was really, you know, having a hard time in her abilities, both coping with the losses and changes in her husband due to Parkinson's disease. His disease was more advanced than hers. And then dealing with the own loss of her own abilities. You know, I used to run a marathon, Lori, and now I have a hard time just getting the garbage, our garbage pail to the end of the driveway on garbage day. So really accepting the loss in abilities can be difficult for any person. And then there's also a lot of frustration in losing control over one's abilities. So I think the depression can be really connected to both the physiological, the physical changes, as well as some of the changes that happen in memory and thinking. And we know that people look differently when, as you saw from that pictorial, but also, you know, someone's often may look or appear depressed or withdrawn, and that's because of that facial masking that occurs as a result of Parkinson's disease. So, you know, anxiety is a challenge of its own, right? We've all experienced symptoms of anxiety. Whether you think back to your school days and you were studying and trying to pass a test, or maybe you're in school now, or thinking about a particular work project, or maybe you're a parent and one of your kids was having an issue at school or a health issue and you felt incredibly anxious about that. So we've all experienced it. We know that it can be very physical, right? Anxiety can create lots of physical symptoms when we experience it, whether it's restlessness. It can affect our ability to get good sleep, right? So if we're anxious about something and we go to bed thinking about it, what happens? You know, we're lying in bed, we're thinking about this project or problem, and what happens? Those racing thoughts interfere with our ability to get good sleep. Affects our ability to really concentrate. We're preoccupied with whatever might be triggering this anxiety. We can feel it physically. In fact, at one time when I was living in the Midwest, just after I'd finished graduate school and I was working in a mental health center, the statistic there was that the number one reason people were ending up in the emergency room, one of the top reasons was because they thought they were experiencing a heart attack, but many of them were really experiencing anxiety or a panic attack. In fact, one of my colleagues at the time, a fellow social worker, was sharing with me that she'd had the same experience. She woke up in the middle of the night and was experiencing a racing heart and was sweating, and her heart was palpitating and she could feel it in her chest, and her partner headed to the emergency room. Well, it turned out for the first time she was really experiencing a panic attack. And so for people living with Parkinson's disease, there's often a panic or anxiety about losing control. So, I'm losing control over my body. I'm worried about if I'm walking to my doctor's appointment, am I going to lose control, or am I going to trip, or am I going to have a fall? And that really can often lead to a lot of excessive or constant worry and nervousness. Now, there are times when anxiety presents itself all on its own, and the anxiety can feel very overwhelming. But then many people experience both those signs and symptoms of depression, as well as those panic or nervous or worry symptoms that are related to anxiety. I've worked with many people who have shared in support groups that they really have this fear of falling. They recognize that their balance and their gait isn't the same, which is again another reason to continue exercise at your level, of course, with the supervision or recommendation of your doctor, because it really can help minimize the chance of a fall. So fear of falling can be really overwhelming for people as they're worried about, sometimes it's social, worrying about being judged in a social situation if I were to fall, or it might be of recognizing that as someone who's living with Parkinson's disease, a fall could have a huge impact on the course of, my wellness, right? I could end up in the hospital. I could have a fracture. What would happen then? How would that really impact my ability to take care of myself, or how would that impact my ability to be independent? So I think for any of us, the thought or idea of losing independence and relying on other people creates a lot of anxiety, and rightfully so. And then I think, for many people living with neurodegenerative diseases like PSP, like Lewy body dementia, like Parkinson's disease, like Alzheimer's disease, there's often this stigma of having a progressive neurodegenerative disease, and that can create a lot of anxiety for people as they might feel like they're not being welcomed. And I have to say, having been part of the movement disorder community, I will say that many people and caregivers and care partners and family and friends have really worked hard to create their own community, to really reduce stigma and really to advocate for their needs. And it's been really impressive to see. It's very empowering. So I think when you feel that your world is closing in as a result of the disease or progression, often it can be very empowering to take charge in the way that you can for yourself. And we'll be talking more about that as we move along. So there are certainly emotional challenges, mood changes related to decline in abilities and function and ability to be as independent as I might want to be. And often I, as a person living with Parkinson's disease, might feel self-conscious or not comfortable being reliant on others for help or care. I want to do it myself, right? That's kind of the way in our culture. And so sometimes my own frustration, is really demonstrated or displayed with irritability, frustration, or even sadness. And often the person with Parkinson's disease might share or talk about guilt about how their illness is affecting others. Maybe they're talking about worrying about their partner or spouse or children, having to take care of them. And so that can relate and create lots of challenges, both for that person emotionally, but also in the family system and in our relationships. So while psychosis is not quite an emotional issue, it is really more of a psychiatric issue. I will say that it really can be a big problem for people living with Parkinson's and other movement disorders, Lewy body dementia, and other illnesses. And the reason I raise it is just to be aware that it's not uncommon for somebody with a movement disorder to actually see or hear things that aren't really there, or hallucinations. So hallucinations are, people kind of get the terms mixed up, hallucinations, psychosis, and delusions, but really they're all part of psychosis. And hallucinations, I always it helps me to think about it as something that's sensory in nature. So seeing, hearing, or even feeling something that isn't really there. And for people with Parkinson's disease and related movement disorders, it can be a result of a side effect from a medication. It also can be a result of having a movement disorder, a symptom. And then related to both insomnia and sleep, and as we're talking about behavioral changes, I mean, a REM sleep behavioral disorder is very common in people who have movement disorders. In fact, many people develop these REM sleep behavior disorders, or an RBD, even before they show symptoms of any kind of movement disorder. In fact, there's a statistic I was reading about that said that actually 80% of people who have a REM sleep disorder actually develop some kind of neurodegenerative disorder within 10 years of their first symptoms. And so what's interesting about these sleep disorders is that someone might have vivid dreams, but actually they start acting out their dreams. So I've actually worked with couples who were sleeping in the same bed, and in this particular scenario that I'm thinking about, the wife actually got some bruises. I mean, her husband was acting out his dreams and they were sleeping in the same bed, and she got kicked and punched as a result of this disorder. And so this can be treated with medication, and it is really important to talk to your movement disorder specialist about that. It certainly impacts somebody's ability to get comfortable sleep. It certainly affects intimacy in relationships, because, you know, as we're talking about really looking holistically at people, at their physical symptoms, we also look at their relationships and intimacy. And Parkinson's disease can really have a deep effect on the intimacy that goes on in relationships, and this is one example. So let's talk a little bit about fatigue, because I think fatigue is definitely related and complicates someone's emotional state. If the people around you are telling you, hey, get to that boxing class, or, you know, get up and take a walk every morning, and 50% or more of people with Parkinson's disease are reporting that it's their biggest problem. And it's a difficult problem to treat. It's hard to measure it. It kind of is insidious and develops over time, and it's certainly difficult to treat, right? I mean, we don't really have a pill for fatigue. I mean, there are stimulants that can be used and medications that may be used to try to combat it. But exercise is actually really one of the best interventions here. And again, I know that sounds counterintuitive when you're saying, hey, I'm exhausted, and you're telling me to exercise. What do you know? But it's kind of like this fine balance of fatigue is kind of cyclical. So it's like you're exhausted, right? So then you don't exercise, you don't move your body. But what happens to the fatigue? It actually gets worse. And so trying to implement before, as early on as you can, some kind of exercise or movement protocol is really important. And I think that's true for all of us, right? Especially for the fact that we're also confined now. Maybe the gym or those classes that you were going to have been paused, and you say, well, how am I supposed to get exercise? Well, yes, you're right. We really do have to be creative about it. We have to, especially in the summer heat, we have to get up very early. It could be 5 or 5:30, and if you're saying, well, how could I possibly do that if I'm fatigued? Well, maybe you do get up early and you take your walk if you're able to, or do some stretching or movement outdoors or indoors, but then maybe you're going to have a rest period afterwards. Maybe you're going to take a brief nap afterwards so that you're not feeling so deprived of sleep. So it's kind of like this fine balance that's, I know, really difficult to implement, but really important. So apathy, we have folks who are really feeling a lot of apathy, and I think of it as like a veil. It really causes that person to lose motivation in routine tasks, and it can cause, it also interplays with that mask-like facial expression that Parkinson's can create for people. Apathy can be, responsiveness to people around them and decline. So I often have had family caregivers who share with me, my person doesn't even really care about me. It's not that, it's this apathy. It's this apathy that is created and triggered as a result of Parkinson's disease. And their interest in previously enjoyed hobbies may really dampen as a result of apathy. And there's often like this tug of war that's going on in family counseling, as the caregiver may be really believing that their person is giving in to the disease. And so then we get into this really unhelpful cycle of the caregiver wanting to nudge or nag the person because they feel like it's their responsibility to make sure the person's getting exercise or engaging in activities, which is true. But we get into this push-pull where the caregiver is feeling very frustrated with the person because they think they're giving in, and the person with the disease is feeling frustrated because they feel like their care partner, all they're doing is nagging. And so it can be really difficult for them. So I think what is so interesting about apathy is that often it is more apparent and more distressing to the family and creates this conflict in the relationship. Apathy can certainly negatively impact somebody's emotion, but some people argue that it's really protective to the person, as it really works in place of sadness, worry, and distress. So Dr. Joseph Friedman, who wrote a book called Brain and Behavior and has done updates on that book over time, talks about this idea, and it was really interesting to me when I first learned about it a number of years ago. He says that it's really protective to the person with the disease, as it really can work in place of depression or sadness. There's very limited research on apathy and treatment options. In some cases, if it is connected to depression, it can be treated that way. More often than not, what we're really trying to do here is to really structure someone's time and make sure that they're getting to activities and can agree to kind of balance this apathy and fatigue with some structure. So that leads us to what can we do about this emotional impact? I mean, we're saying that it's an important part of the disease and really an important part of looking at someone's wellness. Medication can be helpful, often in treating symptoms of both depression and anxiety. And then we know from research that mindfulness and relaxation practice can be incredibly helpful to all of us, but especially to people who are struggling with depression, anxiety, trying to cope with a new diagnosis, or a diagnosis that has been more difficult to endure as the years keep passing. Support groups can be incredibly helpful in creating a community where people feel supported. So I have a caregiver in our Coffee Talk support group who has always been really open and honest about her feelings. And she says that while her and her husband have felt more isolated from their original group of friends, they found an incredible amount of support and socialization within their Parkinson's support group, because if her husband seems to be having a bad day and he's not feeling on, or he's just not feeling well and they can't go to an activity that was planned, their Parkinson's friends who are also experiencing the disease and living with it understand. Counseling and support can be incredibly useful for the person who is living with Parkinson's disease and really helping them feel supported. I think there is stigma still to this day around brain diseases and also around mental health and counseling. And it is certainly a sign of strength to ask for help. We all experience periods of time in our life where our normal coping skills are just not working. And so it's very, it's what we end up wanting to do is just isolate further, but instead to really push ourselves to ask for help is incredibly powerful. In fact, during this time of the pandemic, when people were already feeling isolated as a result of their Parkinson's disease, living with it in their family, we feel exponentially more confined and more socially disconnected. And so this is a perfect time for us to really reach out to a virtual support group or connect with friends and family by phone or through FaceTime or another modality. And it's also an equally good opportunity to reach out to get some counseling, both whether it's you as an individual who's living with the disease, whether you're part of a dyad, you have a care partner, or your whole family to really get the support that you need. And then creating, again, especially during this time where the days feel so long and our normal structure has been impeded, it's really important for us to insist upon creating time for activity, structure, and exercise. So Parkinson's disease and the motion, often in counseling sessions with the person with Parkinson's disease and their care partner, the person was feeling withdrawn, maybe they're feeling very apathetic, maybe they don't feel like they can actually participate in some of the same activities they always have, but they're feeling this struggle that we talked about earlier, and maybe will make promises to their care partner to do differently or try harder. But as a care partner, as a family member, it's important to understand that we do want to help the person achieve some of these small goals for their wellness, but understand that the person might not have the energy that they normally do to work harder. The person may be experiencing thought slowing, or as the disease progresses, even some cognitive changes as a result of Parkinson's. And so they might agree to make changes, but then later they forget about it. And they're not trying to be manipulative, but they're just forgetting. And then, apathy can really interfere with a person with Parkinson's ability to really take action and make changes. And so it's important to really try to keep those things in mind so that we can partner with the person rather than play tug of war. So over time, many people with Parkinson's disease in our support groups or in counseling sessions have said things to me like, I'm trying as hard as I can. I wish my spouse, partner, fill in the blank, would understand I'm not trying to be difficult. I don't want to be defined by my Parkinson's disease. I'm not a Parkinsonian. I'm not, I don't want to be defined. I don't want my whole identity to be my Parkinson's disease. Some people have shared that they felt very alone, or as Michael J. Fox said in one of his books, how do I lose parts of my brain without losing my mind? And what I think he was talking about here is, how do I live well with this brain disease and manage to cope effectively? So I think what's important to notice with any of these disease states is that these are family diseases. They affect the person with the disease, they affect their friends, they affect their close family members. And so I think caregivers and family and friends play a very critical role. And I think over time we've done a better job, but we sometimes overlook how significantly these disease states impact the people around that person. So I think support for families and care partners is essential. Caregivers often share that they struggle with frustration, maybe their own symptoms of depression or anxiety and social isolation. often in the folks that we see in the West Valley, couples are both aging, and we have aging folks taking care of each other. So they're both managing Parkinson's disease and maybe a whole range of comorbidities of other health-related issues. Or maybe the person is younger, and so they're managing both, they're trying to figure out how they're going to continue to manage young children while taking care of themselves or their partner. Or maybe it's an adult child who is taking care of kids, a job, but also trying to manage their parents' wellness. And so it really can take a toll if we don't recognize it, shine a spotlight on it, and do something to support the family system. So I think caregivers and family members are a critical piece. They benefit from support and sometimes from respite and breaks, depending on how much care they're providing. And I think this is true as a therapist myself, and really spent most of my career working with aging adults. I think that it's really good time. It's really good for people to spend time together, but it's also good to have time apart, right? In fact, I often would see people in my private practice for counseling when one person retired. Maybe the dyad had never really spent that much time together during the day, and now they were together all day and all evening, with or without living with a disease state like Parkinson's disease. It was just really disruptive to them. They hadn't really been able to cope that well with it. So they came into counseling to really kind of figure out, how do we figure out our things we can do to spend time together, but how do we also figure out things we can do on our own to spend time apart, so we have something to talk about and something to connect with. And with these long progressive degenerative diseases, they can become very intense at times and require a lot of energy as a care partner, as maybe originally when the diagnosis was new, it was just really about us figuring out a plan for ourselves and really coping. And as the disease progresses, I might now be taking over things that you're unable to do as a result of your Parkinson's. Maybe you're having some problems with memory and thinking, and I've got to take over things I've never done before, like bill paying. Or maybe despite exercise and medication intervention, the disease is progressing, and I'm having to help the person with Parkinson's disease with actual activities of daily living, because they're really having a hard time with balance. So getting dressed on their own is really difficult. And so caregiving can be an incredibly rewarding job, and yet it can be difficult. I think it's just important to recognize, and I put this here actually because I think many caregivers don't even really recognize their caregivers or care partners. And there isn't, you don't have to be taking care of someone 24/7 to actually be a caregiver. And caregivers come in many forms. It can be that you're the person's neighbor, or maybe you're a sibling, or maybe you're a partner. So I think it's important for caregivers to recognize they are caregivers, so that they can also maybe take a closer look at their own wellness, because caregivers are often really good at taking care of the other person, and what gets forgotten or dropped is taking care of themselves. So care partners experience a lot of the same losses as their person changes. They grapple with ever-changing and sometimes increasing responsibilities as they have to take over certain things. They agonize when the role of partner, child, sibling, fill in the blank, shifts to caretaker. And as the person with the disease may become more socially isolated, as does that care partner. And so it's really critical that we recognize that care partners deserve, need, and require their own level of support as the disease progresses. Friends and family may withdraw, which is why it's important for the caregiver to ask what they need, and to fight the fact that the world may be becoming smaller, as we're maybe not able to participate in the same activities in the same way. And so what I think happens as we face these challenges and life hurdles is that we have to learn how to control what we can and let go of what we can't. And that's a really hard ask. So that's going to bring me to talk a little bit about ambiguous loss. And ambiguous loss is a term that was brought to my attention several years ago when my colleague at Banner Alzheimer's Institute, Susie Favreau, got really interested in the idea of ambiguous loss. And ambiguous loss is really the idea that someone can be both present and absent at the same time. So what do I mean about that? It's a term that was coined by Dr. Pauline Boss, many of you, and feel free to make a note in the chat box if you've heard of it and are familiar with any of Dr. Boss's works. But, it's really about dealing with the fact that as someone living with Parkinson's disease, I'm changing. So ambiguous loss is often the loss that we're feeling as abilities are changing over time. We're grieving someone who's here physically but maybe changing. And so we're grieving the losses caused by a progressive neurodegenerative illness. And I think we're not just grieving those losses, but also thinking about the losses that we might anticipate in the future. I think it's a challenging adjustment, as it's often difficult for us to anticipate a happy ending because we know that the disease is progressive. And we're grappling with the idea that things are not going to return to the way they used to be. So I think that's a really difficult thing for people to experience, right? The loss occurs as the person, family, and friends may cope with the physical decline of that person. So why is this important? I think just naming it can be incredibly helpful for both people who are living with the disease, who have awareness of the grief that they might be experiencing it, as well as for caregivers and care partners. I think it really helps us cope with the changes that are occurring in movement and emotion. And what we're trying to do is work through the feelings to find a new normal, knowing that things will change with progression. So I think what ambiguous loss teaches us is that it helps us build an understanding that we can grow with acceptance. And so what ambiguous loss teaches is a number of strategies. One of which is that as a care partner, we have to do two things at one time. We have to take care of the other person and we have to take care of ourselves. And most often we think to ourselves, well, I can't do two things at one time, right? I can't jump up and down and chew gum. So I'm just going to chew my gum. I'm just going to take really good care of this person. And I don't have enough energy to take care of myself. And that is, unfortunately, a recipe for disaster. Because what happens is that care partners who are often experiencing very high levels of stress, feeling very overburdened, share in groups that they maybe feel resentment over this disease, frustration with the condition that their person may be living with, and just downright overwhelm. This is not what I signed up for, and this is not what I should be experiencing it, right? And so this happens to all of us, right? As we face something really overwhelming. Maybe it's something you thought about, in week 3 of the pandemic. When I left the office and I've been working from home mostly, I thought I would be gone for a couple of weeks. And that was on, I think, March 13th. And here we are now. And so a resentment, frustration, or anger can really rise as we feel like, I'm not sure how much longer I can handle this. I don't know how much more of this I can take. And that applies to Parkinson's disease. It applies to COVID-19. We have this fatigue, like, oh, how much more can I manage? And so partners often describe a feeling of loss of their own. Maybe it's over, if they had a romantic relationship, maybe it's over that intimacy or even their sexuality in the relationship. If it's a daughter taking care of her dad, maybe she's expressing that she feels more like a parent than a daughter. As his needs increase and she is providing more care. It's maybe a loss in communication, as Parkinson's we've seen and we've talked about that it can create a social withdrawal. Maybe it's a loss in that reciprocity and support, and that's what's so difficult about these neurodegenerative diseases like Parkinson's or Lewy body or PSP or Alzheimer's disease, is that reciprocity and empathy and support often becomes one-sided. And so as a care partner, I might feel really angry with my person because I feel like they don't appreciate me, or they're not recognizing how much I'm doing for them, when they really do, but maybe they can't express it as a result of the dampening of emotion that comes with Parkinson's disease. And so what happens sometimes is that we get so overwhelmed by the disease, we feel like, we can't have laughter, we can't have fun. We've got this monkey on our shoulder. And so some of the quotes that care partners have shared with me and in some of our groups is, you're not alone, but sometimes you might as well be. That person seems so withdrawn. You have to care for that person, take over so many responsibilities that I feel completely overwhelmed. And you miss the sharing of intimacy in a relationship, sharing of responsibilities, sharing of decisions, support, and someone to stand by you. I think it's important to recognize that these are all a result of the disease. The person is not insensitive to you. It's not that the person doesn't care about you. And you have to remind yourself that the person loves and appreciates you, even if they're not able to verbalize it themselves. We have to avoid that push-pull of nagging, as all it does is increase our own anger and frustration. And it separates us and creates frustration and negatively impacts our relationship. And we have to continue to work on the connection. There's a woman named Dr. Sheila Silver, and she writes and presents, I heard her speak many years ago at a movement disorders program for professionals, and she spoke about intimacy and Parkinson's disease. And she says that we have to continue to work at the connection, whether it's our partner and we miss that physical connection. We have to find other ways to connect. So I think as human beings, we tend to be very tunnel visioned. What happens is we feel like, this person can't connect with me emotionally, or can't emotionally support me any longer because their disease is progressing. This person and I can't have a physical or more traditional sexual relationship if we're spouses or partners. And so that's the end of that, and I'll just have to go without. Instead of finding ways to work at the connection. So this is where what I was saying earlier, we have a choice here. We can decide that the person can't support me anymore and I'm no longer ever going to have support, and we can have a pity party for ourselves. And pity parties are okay. It's okay to feel sad and upset about your situation. But if you get stuck in there for the long term, who misses out? You and your person. So I think we have to find ways to get our needs met, and that we have control over. So I know it sounds simple and it's not, but as somebody once said, you'll excuse me for a moment as Banner wants me to log back in. We have this policy in practice now as we're trying to remain safe, and we're trying to make sure that people don't come to work while they're ill. I'll take care of this. And what happens is we get stuck in feeling sorry for ourselves. So back to our content. We have to get support for ourselves. And as a care partner said to me in a support group, she had had just a horrible week where her husband with Parkinson's disease not only wasn't doing well, but landed in the hospital. And it was a very stressful situation for them. And I said, wow, I'm so impressed that you're here today at the support group. And she said something I thought was really important. She said, I can't afford not to be here. And so I think that was her way of saying that, yes, it feels like a burden to get to a support group on top of everything else I've had to do with my caregiving duties. But if I don't take care of my own wellness, then I could prematurely die. Many caregivers die before the other person, or they end up in the hospital with a heart attack or other things because they haven't taken care of themselves. So getting support for yourself is critical. And I think with these diseases, what we want to do, or automatically often do, is withdraw ourselves. So finding a way to get the support you need. And what's nice now, I know that people would rather be in person in support groups, and support groups have suffered as a result. However, what is nice now about these virtual support groups is that we've removed the barrier of getting respite if that's necessary in order for you to go to a support group. We've removed the travel, and we've removed the barrier of you have to be at a support group in Phoenix if you live in Phoenix, because you certainly don't want to have to drive to Tucson or somewhere else. Well, those barriers have been removed, so I think it's all about how we perceive it. So that's what I mean when I say we can make up our minds to say that, our person with Parkinson's disease can no longer be empathic or a good support to us, which doesn't always happen, but in some cases does. Or we can say, you know what, maybe that person isn't capable of that part anymore, but I've got to take it upon myself to get support from somebody else. I've got to stay connected to my friends, even though I don't feel like it. I've got to stay connected to social events or social connections, which are done so much now virtually. I have to take care of my own self, my own body through exercise and getting to my doctor appointments or whatever I need to do for my own health and wellness. I have to create my own recreation and hobbies. I've got to find ways to relax and maintain my spiritual connections if those are important to me. And implementing respite, which during this time is incredibly difficult, right? Getting great breaks from caregiving. Maybe your person went to a neuro wellness program for a couple hours and that's when you got your break. Or maybe your person was participating in a life enrichment program in person and that's when you got your break. Or maybe you had a professional caregiver or volunteer caregiver that came in and now that's becoming more difficult as you might be fearful of, protecting you and your person from the virus. So maybe it's use of hired caregiver, family, or friends. Maybe it's that, we just have a small circle or a pod, as I've heard that term used during COVID-19, of people that are safe, that really protect themselves well during the virus or aren't going out much. And we use those folks to really commit to us because we need the support and we need that connection. And learn how to ask for help. That's something that many of us struggle with, that independence and that feature of our culture that says that we don't ask for help and we do everything ourselves, and that's how we're raised and we're proud of it. It's overrated, right? We have to learn how to ask for help. I've run support groups where that was the entire hour that we spent, was really talking about how to ask for help. And so I think some of these tips, and if you're interested, we actually have created some care tips on Parkinson's disease. If you message Chase, we can get those over to you specifically on some of these challenges that we're talking about, things like apathy, and how do I manage apathy? How do I manage depression as a person living with Parkinson's disease? Or how do I manage ambiguous loss? Life is ambiguous, right? I mean, it's incredibly ambiguous right now as we're living through a pandemic. As I mentioned, I thought I would be back in work in a couple of weeks, and here we are with cases that have been rising in July. So I think we have to learn tools and gather tools for our toolbox. And well, maybe our old tools aren't available to us. So for me, going to the gym was a really important for me in a lot of ways, not just from a physical standpoint, but emotionally. Going to the gym is really helpful to me. And I actually have a lot of friendships that have been developed over going to the gym. So, the first week or two of the pandemic, I said, well, I guess I don't have gym and exercise, right? But that's not where it ends. Then I had to decide that I was going to find a way to exercise in a different way, or my wellness was really going to be at risk. And so instead of the commute that I usually have, I decided to take that time in the morning to walk my dog. And usually I'd walk my dog for a few minutes, but now we're walking, miles, because that's really important for my wellness. there are lots of ways to capitalize. I mean, there are lots of exercise videos on YouTube that you could use to get your exercise. If you're someone living with Parkinson's disease, there are specific videos that are geared towards people who are living with the disease. Or maybe you had physical therapy or neural wellness in the past, and now you're going to connect with that through Zoom, or you're going to try to do some of the exercises that you've learned. And I think the same is true with mindfulness. I mean, there are ways to implement those things by phoning in, or maybe this is your time to get up to speed with technology, and maybe you never had to before and you don't like it, but it's impeding your ability to stay connected with the world. And actually, somebody I work with, Banner, was telling me that her in-laws had never used Zoom before or FaceTime, and now they recognize that if they didn't learn how to use it, they weren't going to be able to see their grandchildren because they live out of town and they're remaining socially distant anyway, and so they had to learn how to use those tools, just like you're doing here today. So I think I'm just going to end with this quote from Michael J. Fox, because I've read a few of his books, and I think that he really gets this idea about making choices. And as Virginia Satir, who's really the matriarch of family therapy, says, life isn't how it's supposed to be. It's what we make of it. And so difficult and tragic things happen to any one of us every day, and some more than others, and sometimes you might feel like your hurdles are much bigger than anybody else's in that moment. And he says, for everything that this disease has taken, and remember that he developed Parkinson's when he was in his 30s, something with greater value has been given. Sometimes just a marker that points me in a new direction that I might not have traveled otherwise. And some days it feels like I'm taking one step forward and 2 steps back. But after a time of living with Parkinson's disease, I've really learned that what is important is making one step count. And I think that is really poignant in that he shares that he's had a lot of his own struggles and a lot of obstacles. And a lot of it is how you frame it and how you decide you're going to live with it. And so that choice is within your own realm. And so I think as you decide to, whether you are a person living with the disease or a care partner or a family member, or you're just struggling, coping with this current condition, this current state of our world, you can't control the coronavirus. You cannot control Parkinson's disease, but you can control your actions around them, right? So with coronavirus, we can control wearing a mask. We can control staying home from things, even though we might want to be there. We can control that fact that we can't go to the gym or the neuro wellness center or the kickboxing class in person, but we can try to do some of these things at home. We maybe can't connect with people face to face in a big room, and there's a lot of social connection there, but maybe we can attend a church or temple service via Zoom, or call and listen in, or a support group that maybe we thought, I don't need that, I'll be fine. Maybe we can be proactive in really making good choices for our own wellness, even though we have to nudge ourselves a bit. We have to say, this isn't easy, maybe this isn't what I wanted to do, but I'm gonna take that step. I'm gonna get out of my own way, as I often say in therapy, right? We sometimes get in our own way of wellness. We say we don't have enough time. We say that I just can't put another thing on my plate. I'm so busy taking care of my other person, my person with Parkinson's disease, that I don't have time to take care of myself, Lori, and stop badgering me about it, right? But what we can say is, wait a minute. We can do 2 things at one time, and that's really, these are some of the strategies we learn with ambiguous loss and we learn with counseling and therapy, is that we can do 2 things at one time. We can get up 10 minutes before a person with Parkinson's disease and just sit outside and take some deep breaths while we have our coffee. There are portable things that we can do for our wellness, but we have to decide it, and we have to plug it in, and we have to follow through. And it's not a one-time fix, right? It doesn't help us to just do it one time. It's something we have to make part of our everyday experience for it to have a more significant impact over our wellness. I think that is what I wanted to share with you, and I'll give you a moment if you want to put some comments in the chat box or ask any questions. I also just want to say that, as I mentioned, we have support groups that are going on through Banner Sun Health. We have a coffee talk group. We also have a Parkinson support group for care partners exclusively. And then there are lots of great opportunities in our community. We have a neuro wellness program that, as I mentioned, we're hoping to relaunch virtually in August. There are lots of great community partners that have lots of great programming, like the PMD Alliance, and lots of great things on their website about virtual support groups and programs and ways for you to stay connected. And with that, I will stop talking and check in with my colleague Chase to see